If you're over 70, there's something you need to know. Some of the medical checkups you've been told to get, those so-called routine screenings, might be doing you more harm than good. This might sound shocking, even dangerous to say, but it's backed by real science. Millions of seniors line up every year for tests that are supposed to protect them. But a growing body of evidence now shows that many of these tests just fail to help. They can lead directly to unnecessary treatments, medications with harsh side effects, and even risky surgeries that offer no real benefit. One of these tests, in fact, is now linked to as many cancer cases as daily alcohol consumption. Yet most seniors never hear this from their doctors. Why? Because the truth is buried in medical journals, not advertised on billboards or mentioned in your local clinic. In this video, we uncovering the 5 most overused and potentially harmful medical tests that seniors over 70 should think twice about. These aren't obscure tests you've never heard of. They're mainstream, they're routine, and that's exactly what makes them dangerous. Let's begin with the first on our list. Number 5, the bone density scan, also known as the DEXA scan. It seems harmless. A quick scan to measure your bone strength. No needles, no pain, just information. But for people over 70, especially women, this test often causes more fear than benefit. Why? Because bone loss is a normal part of aging. Just like graying hair or wrinkles, reduced bone density is expected in older adults. But this test rarely distinguishes between harmless age-related bone thinning and serious osteoporosis. So, even mild findings often lead to prescriptions for medications like bisphosphonates, drugs that are supposed to strengthen bones, but come with serious risks. These medications can cause jawbone deterioration, chronic acid reflux, esophageal damage, and, paradoxically, make bones more brittle in certain areas. And despite these side effects, the actual benefit in preventing fractures is incredibly small. One study of women over 70 found that treating mild bone loss with these medications reduced fracture risk by just 0.3% over 5 years. Meanwhile, side effects were much more common and in some cases debilitating. Take Rose, for example, a 76-year-old retired piano teacher. She exercised daily, never had a fall, and felt great. After a routine scan, she was told she had osteopenia, a mild form of bone loss. Her doctor prescribed a bisphosphonate immediately. Within 3 months, she developed severe reflux and jaw pain. She stopped playing piano altogether. After we took her off the medication and started a new plan based on vitamin D, weight-bearing exercises, and calcium-rich foods like sardines and leafy greens, Rose made a full recovery. A year later, she was performing concerts again, stronger, more balanced, and completely medication-free. For seniors who aren't falling or experiencing bone pain, the smarter path may not involve scanning at all. Instead, focus on strength training, balance exercises, proper nutrition, and correcting vitamin D deficiency. According to a 2022 study published in Osteoporosis International, this approach can reduce fracture risk by over 20%, far more than any pill. Now let's move on to the 4th checkup. Number 4, the brain MRI for mild memory loss. It's one of the most common reactions to forgetfulness among seniors. Misplace your keys a few times, forget a name or two, and suddenly there's fear of dementia, fear of Alzheimer's. Doctors often respond by ordering a brain MRI. But here's the problem. These scans rarely provide clear answers. In fact, most show nothing more than normal aging, small areas of shrinkage, harmless white matter changes. But once those changes are seen on a scan, it often sets off a chain reaction: more tests, more doctor visits, even invasive procedures. A study reviewed over 3,000 MRIs in patients aged 70 to 85 who had mild memory complaints. A full 86% of scans showed some form of abnormality, but only 3% revealed anything treatable. That means nearly every senior in that study went through the emotional toll of being told something was wrong, when in fact, it wasn't. George, a 74-year-old retired engineer, came to us with some mild forgetfulness. He was sharp, but he misplaced things occasionally. His MRI showed white matter changes. The result? He panicked, stopped driving, withdrew from social life. Over the next few months, his anxiety worsened. But when we gave him a cognitive screening test, a simple paper exam, his memory was well within the normal range for his age. What made the difference was lifestyle, better sleep, hydration, daily puzzles, and memory games. Within 3 months, he was back to normal. Unless there are serious neurological symptoms like seizures, rapid personality change, or severe cognitive decline, a brain MRI is often unnecessary. A paper-based cognitive screen is safer, quicker, and more helpful as a first step. Number 3. The cardiac stress test. This test is often ordered for seniors who feel a bit more tired than usual or describe mild chest tightness. It involves walking on a treadmill while hooked to a heart monitor or receiving a drug that simulates exercise to see how your heart responds. But for adults over 70 who don't have clear signs of heart disease, this test has a false positive rate as high as 40%. That means many people are told they have heart problems when they actually don't. Those false alarms often lead to more invasive procedures, angiograms, stents, even bypass surgeries. And the consequences can be serious: bleeding, kidney damage from contrast dyes, or complications from anesthesia. A large study published in a leading cardiology journal found that over half of all stents placed in seniors after stress tests provided no improvement in lifespan or quality of life. Take Raymond, a 75-year-old retired postman who walked every day. He mentioned feeling slightly winded when walking uphill. His doctor ordered a stress test just to be safe. The results were ambiguous, so he was sent for a catheterization. A mild narrowing was found, and a stent was placed. But that night, Raymond developed kidney issues from the contrast dye. He spent 6 days in the hospital. The fatigue never changed because it wasn't his heart. He just needed more rest and better hydration. If you're over 70 and not experiencing classic symptoms like chest pain during activity, shortness of breath, or dramatic drops in energy, a stress test may do more harm than good. Safer options include a resting EKG or a coronary calcium scan, which are less invasive and more reliable for seniors. Number 2. The colonoscopy after age 75. Most people assume colonoscopies are a must, and for younger adults, they can be life-saving. But after 75, the math starts to shift. The preparation for the test, heavy laxatives, dehydration, and sedation, can be especially hard on older adults. The risk of complications like bleeding, bowel tears, and sedation-related memory issues rises significantly. In a study of 1.3 million seniors, for every 1,000 colonoscopies performed on patients over 75, only 2 lives were saved. But more than 20 people suffered serious complications. Dana, a 73-year-old grandmother with no symptoms and no family history of colon cancer, was convinced to get a colonoscopy by her new doctor. A tiny polyp was found and removed. That same night, she experienced severe abdominal pain and collapsed. She was rushed to the hospital where doctors discovered a perforated bowel. She spent over a week in recovery and never quite returned to her former health. There was no need for that colonoscopy. She had already had 2 clean ones in previous years. For healthy seniors, a better option may be a stool-based fit test, which can be done at home and doesn't involve sedation or prep. And finally, the most overused and potentially dangerous test for older adults. Number 1. The annual full-body CT scan. These scans are sometimes included in high-end executive physicals or private wellness packages. They're marketed as preventive, a way to catch diseases like cancer early. But they come with a hidden danger: high-dose radiation. Each scan can expose you to the equivalent of 500 chest X-rays. And recent studies show these scans may now account for up to 5% of all new cancer cases in the United States. That puts them on par with alcohol as a cancer-causing factor. What's worse, most of what they detect is harmless: cysts, tiny nodules, calcifications. But once found, these benign findings often trigger follow-up scans, biopsies, or even unnecessary surgeries. Marcus, an 80-year-old martial arts instructor, felt great. He signed up for a full-body scan at a wellness clinic. They found a tiny lung nodule. He was referred to oncology, sent for more imaging, and eventually underwent a needle biopsy. It was benign, but the biopsy collapsed part of his lung, and he spent 2 months recovering from a complication of a scan he never needed. The American College of Radiology strongly advises against full-body CT scans in people without symptoms. Unless you have warning signs like unexplained weight loss, visible swelling, or persistent bleeding, these tests are more likely to hurt than help. So what's the takeaway? Medicine has saved millions of lives, but more testing doesn't always mean better outcomes, especially as we age. If you're over 70, it's time to ask better questions. What will this test change? What happens if it finds something? Is the risk worth it? Sometimes, the best prevention is lifestyle, staying active, eating well, getting enough sleep, managing stress, and making informed choices. You don't need to live in fear of what might go wrong. You need to live in confidence about what's going right. Have you or someone you love ever faced complications from a medical test or treatment that turned out to be unnecessary? We'd love to hear your story in the comments. Thank you for watching, and take care of yourself, because smart choices start with knowing when to say no.